This is Peter J. Pollack, MD from Emedicon, and we're speaking today with Tony Onorad of Onorad Solutions, a healthcare IT consulting firm with a focus on training, and Jason McCormick, Director of Business Development for ICD-10coach.com. Welcome, gentlemen.
Thank you.
Thank you. Good to be here.
So we're going to be talking today about the top 5 steps to jumpstart your ICD-10 project. And I'm going to list them first, and then we'll go into a little more detail with each one. Number 1 is convert your top 20 codes, identify new documentation elements. Number 2 is create training tools. Number 3, conduct simple chart reviews. Number 4, engage your software vendors and payers. And number 5, prioritize your timeline and create deadlines and accountability. So let's start with the first one. Jason, converting your top 10 codes and identifying new documentation elements. So explain why 20 and what's the reasoning behind that?
Well, the reason behind converting your top 20 codes is just to give you a good start on the new documentation elements that are going to be required for the most specific ICD-10 code. And we just have you start with 20. It kind of gets the ball rolling, gives you a feel for what the new codes will be. And, most practices, the top 20 codes is going to encompass most of the documentation and diagnoses that they're seeing. So start with 20, and then also start to identify the new documentation elements. So there's several new documentation elements required to get the ICD-10 specific code.
Tony, explain to us how you would work with a client practice to go through this conversion process.
I think from the first thing that I would do with the client and what we are doing is really looking at the key milestones and the dates and highlight those, reiterate that October the 1st, that deadline is not going anywhere. I think that there was a lot of wishful thinking that, boy, the feds are going to push this back as they are known to do on other projects, but even last week at HIMSS that was reiterated that's not going to happen. And then there to really emphasize from a project perspective to get some really good project planning in place, whether it's an ICD-10 specific project planning software tool. Perhaps the practice has a team, of some key champions on that to manage the project, and then engage your vendors right away and don't take yes for an answer in terms of, hey, EHR system, are you ready for ICD-10? Oh, sure, we're ready. We're going to have a crosswalk for you. As President Reagan used to say, trust but verify, and make sure that your vendors are really engaged. And then test sooner rather than later. I know CMS is undergoing a testing week right now as we speak, and there will be others. So as you're going down the different phases of the transition, test what you can and really do a good assessment and audit of your current documentation.
In order to identify your top 20 ICD-9 codes, just take a look back at your most diagnosed codes for your practice or for your specialty. You'll start to see a lot of common ground there. So if you're going to use a code over and over again, it just makes sense to get the ICD-10 transition and have that ready to go and kind of ingrained into your mind. A couple of the ways that we would suggest that you convert these codes, you could either do so manually using code books, which could be quite tedious and take quite a bit of time, but it is possible to use code books. Another way to do would be to use the GEMS mapping system, the General Equivalency Mapping System, and that would be where you could take your ICD-9 code and translate it one-to-one into an ICD-10 code. The only issue with the GEMS translation is that more specific ICD-10 codes don't exist in ICD-9, so making a direct translation, sometimes you won't get the more specific ICD-10 code. And the third way that you could do that would be to use a software tool that would actually convert and also have a crosswalk that may suggest more specific ICD-10 codes for your current ICD-9 code.
Jason, I think one of the ways that we can do this and you fill in here is through flashcards that you can create after you've converted your top 20 codes. You've got a tool like the Ready10 software offers that will go ahead and create those flashcards for you that you can then use in training. Is there something you would add to that?
You summed it up there perfectly, Tony. As far as documentation training aids or training tools, there's new documentation elements that are required for ICD-10. You've got mild, moderate, intermittent, persistent. Those are just some of the new types of documentation elements that will be necessary to create these ICD-10 codes that weren't actually necessary for ICD-9. So The training aids are going to help out a lot in just reminding, doctors as they're making their diagnosis that they need to include these documentation elements. Otherwise, the coders and the builders are going to be stuck trying to create a specific ICD-10 code, and they'll have to go back to the doctors and they'll start to create, back and forth.
So number 2 is create training tools. So Tony, what would be some of the training tools that you're referring to, and how would they be helpful?
I think after converting your top 20 codes, then to create, hopefully through a software system or other automated tool that maybe you purchased from a good ICD-10 vendor, having some flashcards that can help you then, really practice using those tools and remembering what they are. Other tools that are out there are some webinars that you can attend and participate in terms of doing some chart reviews. And, Jason, anything to add to that?
Yeah, as far as documentation training aids, just reminders for the physicians of the new documentation elements, maybe brush up a little bit on the required elements just to make sure that the most specific ICD code can be chosen from the documentation. Flashcards are great because they're memory joggers. The top 20 codes can be written down in flashcards, and then maybe you carry around the flashcard and get a few moments from day to day. You take a peek at that and start to memorize these codes, or at least the beginnings of them, to make documentation a lot easier and quicker to perform. And then you could practice then. You could create maybe lunch and learns where docs could sit around and go over these new codes, maybe pick one section per week, and then as the ICD-10 deadline approaches, go over all of those 20 different codes and the new documentation elements and the codes surrounding them.
So you would have, as part of this training, some practice drills to keep those skills top of mind approaching the deadline?
Yes, absolutely. And kind of breaking it down into chunks, more digestible chunks instead of just, hey, here's 69,000 new codes, go ahead and learn them. Just taking the top ones and specialty-specific codes and really drilling down on those and learning the documentation elements and also the specific codes as well.
Tony, you mentioned chart reviews, so that brings us to number 3, which is conduct simple chart reviews that reveal current documentation shortfalls and adjust your habits. How exactly do you explain to the practice how they should do that?
Well, I would go through your existing, maybe your top few, last few charts that you have right now and go through and look at, gosh, from a documentation perspective, are we having struggles right now with ICD-9, and is that resulting in some claims being rejected? Where are we struggling with current state, getting that into better shape, and maybe identifying some of our providers who are having a tough time already, and then saying, okay, well, we've got to address these issues, because certainly with ICD-10, that's going to just get magnified. And then looking at, after we've got that exercise completed, looking at ICD-10 and saying, boy, we struggle with this with 9, and 10 is going to get so much more specific. We really need to make sure that we concentrate on these areas as we're doing clinical documentation to make sure that we're really thorough and on our game here and have our quality assurance process, for lack of a better term, in place.
Jason, would you recommend, I've read where some practices have used both ICD-9 and ICD-10 in parallel to sort of have more of a overlap in the transition. Is this even possible or recommended?
Yes, actually, I'm glad you brought that up. ICD-9 and ICD-10 will actually both be in use as of October 1st, 2014. And the reason behind this is that some entities such as workers' comp and auto insurance aren't required to use ICD-10 codes. So you will need to have dual coding capabilities and the ability to read both ICD-9 and ICD-10 codes. So as far as having them side by side or having them work together, many of the ICD-9 codes convert directly to an ICD-10 code, but there are also new, more specific ICD-10 codes. So a direct mapping of like a one-to-one code from ICD-9 to ICD-10 isn't always possible. But yeah, I would suggest being able to have access to both ICD-9 and ICD-10 codes.
Yeah, I would agree if I can add my 2 cents into that, Jason, because, too, from what I understand, there are various organizations, insurance organizations who are going to say, too, if you're booking future appointments, say, I've come in to see my general practitioner in August, and now I've been referred to a specialist that will be in November, to make some of those appointments and to do some of that coding, they're asking for the future appointments to be using some of those ICD-10 coding. So you've got another layer of dual coding going on in addition to workers' comp, disability, and auto claims. So yeah, it's going to be a dual coding world for a while.
That brings us to number 4, which is engage your software vendors and payers. So, Tony, what responsibility does your software vendor have in helping your practice through this transition?
You know, that's a good question, Peter, and it's kind of a gray area. The advice that I would offer to practices is to really, again, trust but verify. I think a lot of the EHR vendors that we're seeing are saying, yes, we will be ready for ICD-10, but that's kind of a vague answer. So I think that you really need to push your vendor and hold them accountable just to say, well, what specifically does that mean? Am I going to have to go through an upgrade in order to be ready for ICD-10? And if so, what other areas does that impact from a user perspective? And then what kind of testing is going to be involved from the system perspective, working with your clearinghouse or your payers or your claims, your billing and your coding. So you really want to have all that wrapped up, I would say, by midsummer at the latest, because you're going to want to work out the kinks. And if there is an upgrade involved, what else does that impact? And now you're outside of ICD-10, and maybe some of your workflows change as a result of having to go through that upgrade. So really hold your vendors' feet to the fire. Don't just take their word, and see what they mean by, yeah, we're ready for ICD-10. What does that include? What is it going to look like? And how are you going to get me there?
And Jason, on the payer side, what advice would you have for practices there as far as what level of communication they need to have to make sure that there aren't any major hiccups as far as the reimbursement?
Well, as far as payers are concerned, I would say, the first thing to do would be to get the testing done, make sure that claims are going through, they're being processed, the proper ICD-10 codes are there in order for the claims to be paid. Have conversations with those payers, especially once ICD-10 is in full effect. There could be issues with payers, and, having those conversations, deciding, is it documentation elements that are slowing us down? What exactly is getting in the way of us gathering that revenue? Testing is a big part of that, so sending the claims through, making sure that they're processed, and just having that open lines of communication with the payer. What are they going to expect? What are we looking forward to come October 1st? There could be some issues with medical claims being denied because the ICD-10 codes are not specific enough. Therefore, they may not be able to prove medical necessity. So those are some issues that are going to come up between the physicians and the payers on the billing side. So, get those questions answered up front. Make sure you're thorough with that. Make sure you have a plan in place so that when October 1st rolls around, claims are processed smoothly and efficiently.
Okay, and then finally, number 5, prioritize your timeline and create deadlines and accountability. So we've been talking about this October deadline. Tony, can you discuss a little bit about what you mean by prioritizing your timeline?
Yes, we all have this October 1 ominous date in our minds, and what I would do from that date is back everything up in terms of, okay, what can we start to do right now? Form our project team, evaluate transition vendors and consultants, identify when we're going to put staff through training and who needs training and what does that look like. Testing, as I mentioned earlier, what are the different testing periods that we're going to have with our payers, our claims people, our billing people, and our EHR systems. And then also, too, keep in mind that while October 1 is this gigantic, stake in the sand, what happens after that? How are we going to evaluate in the first couple of weeks how we're doing? What if we have some providers who are really experiencing more downtime than we had anticipated? How are we going to manage that? And, are we going to have any type of budget issues that we have to anticipate? And how do those affect our timelines and scheduling? Are we going to have to reduce our patient care schedules, or do we feel like we'll be okay? So you've got to factor all those in. I would say well past maybe, and I would really defer to Jason on this with his expertise, but say 4 months past the October 1 go live. So really, what can you do now to plan for this project? Testing, training, go live, and then after go live to manage any risk and disasters that may come as a result of the implementation.
Yeah, I agree with Tony completely. Timeline includes everything from the beginning, from gathering awareness within your practice, communicating that, getting a project plan in place, running through a series of assessments, doing testing. There's going to be a lot of training involved, and then, the go live where, October 1st hit, and did all of our planning and preparation, did that pay off for us, And then even after the go live, like Tony mentioned, monitoring metrics, taking a look at, is my provider productivity going down? Is my revenue stream, are there any dips as a result of ICD-10? And if there are, why? So all of that should be included in your timeline, and they should all have deadlines and the ability to follow up with everyone and make sure that they're each doing their part, because there's so many different moving pieces to the ICD-10 puzzle that, if one piece falls out of whack, the whole practice suffers. So holding that accountability is important as well.
Okay, so to summarize the 5 steps to jumpstart your ICD-10 project, number 1, convert your top 20 codes. Number 2, create documentation training aids. Number 3, perform simple chart reviews. Number 4, engage your software vendors and payers. And number 5, develop an overall project strategy that creates deadlines and accountabilities. Final question, since we're talking about a jumpstart, how quickly can this jumpstart be performed? Is it a 10-day process? Is it a 4-week process? And if it can be done within a week or 2, how would you break that up within that time span?
I would say that, this absolutely could be accomplished in 10 days. It's going to be specific to each physician practice, and it's, self-driven. So obviously the time frame could vary, but if you really buckled down and got to it, going through these 5 steps, you can break it down as, convert your top 20 ICD-10 codes. That could be done with the use of software in a few minutes, actually. Documentation training aids, those could be created in a day or 2, and, if you had some kind of a software tool that could create them for you, again, that can be done much quicker. Chart reviews, those may take a little more time, but if you were to do 10 chart reviews, or if you were to do 20 chart reviews, so 2 per day within 10 days, you'd be able to have that handled, along with, if you had, 10 questions to get you started to begin to collect those answers for key vendors and payers. You could get with a vendor or a payer each day and go through those questions. And project strategy, there's a bunch of different strategies out there. Find one that works for you, pick it, and go with it. Developing that strategy is just a matter of communicating and getting your team together and getting everybody on the same page. So absolutely, I think that this process could be done in 10 days if you were to break it down that way.
Yeah, and I would, if I just can add a little bit onto what Jason was saying, and I agree with everything you're saying, I think it can be, not one person is going to do all those 5 steps. I think that, hopefully you've got someone in the role of the practice manager who can take a lot of that project planning done, combined with a really good ICD-10 project planning software tool that will guide you through creating those milestones and those steps. And then on the clinical side, on the provider side, really don't, for lack of a better term, don't dumb this down. Don't just think, oh, I've got this GEMS tool. It will translate ICD-9 into 10. Think a little bit bigger than that. What if there isn't a direct translation, or what if there isn't any translation? Those unspecified codes that are going to trip you up down the road. And also, when you're looking at some type of translator tool to assist you, can it help you with your training? Can it help you with your chart reviews, your education, creating flashcards? Think of that type of more robust tool so you're not making any assumptions. And again, this isn't as simple as all I have to do is translate a code from 9 to 10. This affects the whole practice and, your billing and getting paid. And someone told me earlier today, unless you're completely independently wealthy and you don't care about any income coming in after October 1, you really need to take this seriously. And that person said it's kind of like planning a really big wedding or a family reunion. It might seem like you're just having a few people over dinner at first, but next thing you know, you're renting a banquet hall and hiring caterers. So take it very seriously, plan well, and invest in some tools that will pay off and that will be more robust than what you probably think you need right now.
For those practices that may feel a little bit overwhelmed about having to develop an overall project strategy, do you have some resources that you can offer as an option?
Absolutely. Getting started may be a bit overwhelming, and trying to figure out this whole ICD-10 transition from start to finish. It could be a lot to take on all at once. So we just recommend getting started. take that first step. So, and part of taking that first step would be putting together an ICD-10 transition planning checklist. Some items to get your practice moving, such as engaging and educating providers, starting the awareness, just getting everybody up to speed about how ICD-10 is going to affect them and what they can do. Start to look at how you can partner with trusted resources. Identify outside additional resources that may be required, and start to take a look at the various ways that you could partner with others that may have more insight and resources available that you may not have. Putting together a transition project team, it could be an item on your getting started checklist. So starting to figure out who's going to be in charge of running this thing and how you can assign tasks to different folks in your particular practice. All that's part of creating your timeline and transition plan. So those are just a few of the ways that you could get started and check off some items on your transition planning checklist to get your practice moving.
Tony?
Yeah, I would agree with that. Checklist to get started isn't that big, and one of the steps that you can do right now is as simple as just identifying, which roles are impacted by coding right now. What roles within your office are touched by ICD-9 coding right now, and those guys will be impacted by the transition to ICD-10, and make sure that they're included in your education and training plans.
Jason, you were referring to trusted resources. Are these people or digital port tools?
As far as trusted resources, they can come from a number of places. You could go online through MGMA or through CMS. They have a lot of great resources that can be used. There's also, associations that you may go through, or outside ICD-10 consulting firms that may be able to help guide you through the process. A lot of it's going to be based upon the impact of ICD-10 on your particular practice. So doing an impact assessment, a mini assessment, will help to decide what type of resources may be required, whether we're going to do it ourselves, we're going to take on, go through a software program and kind of do it with somebody, or we're actually going to have a team of consultants come out and go through it all and do everything from start to finish for us. So when I say trusted resources, those are some of the things I was talking about.
Well, thanks so much.
Great, thank you.
Thank you.